We all know that seniors are at a significantly increased risk of severe disease if they are infected with COVID-19. Globally, about 80% of COVID-19 deaths occurred in those older than 60 years old. In Singapore, we see the same trends. Our death rates from COVID-19 are low, but among these, those 60 and above account for the vast majority. 90% of all COVID deaths here are seniors. Nearly 1 in 6 seniors developed severe symptoms and needed intensive care in the hospital. It is therefore critical that we make extra efforts to protect our seniors. Even as we cautiously lift some circuit breaker measures, we will continue to put in place enhanced safeguards where necessary, especially for vulnerable groups like our seniors. We have not seen widespread COVID-19 outbreaks in our nursing homes locally, but we cannot let our guards down. Since January this year, the Ministry of Health and the Agency for Integrated Care, AIC, have worked with the nursing homes on a range of safeguards. As a further precautionary measure, homes serving the elderly have arranged for client-facing staff to stay at designated accommodation facilities on-site or at hotels during the circuit breaker period. About 2,600 nursing home staff are in the process of moving into hotels. I would like to thank the affected staff for their understanding for the inconveniences they undoubtedly have to face to keep our seniors safe. Testing is an important strategy to detect COVID-19 infections amongst our vulnerable groups as early as possible to limit further transmission. We will test all staff and residents of nursing homes with symptoms of acute respiratory infection. New residents are also tested prior to admission. In addition, since 29th April, we have initiated testing for all 9,000 staff and 16,000 residents of the 80 nursing homes in Singapore. Of the 9,000 staff tested, all were negative for COVID-19 except for 1 staff in Renci at Ang Mo Kio. We have tested more than 30 residents who could be in contact with the staff, as well as those who have acute respiratory symptoms. Their tests are negative. Renci will continue to monitor them. We will progressively test all 16,000 nursing home residents, and we expect to complete this by early June. We expect that more cases will be identified within our nursing homes with this extensive testing in progress. Where there is a positive case, Ministry of Health and AIC will support the nursing home to thoroughly disinfect the affected areas, conduct contact tracing, and quarantine close contacts. Minister Desmond Lee will share more about what is being done in other residential care homes serving the elderly. Beyond nursing homes, we also want to take good care of our seniors in the community and give them a helping hand during this circuit breaker period. Safe distancing does not mean social isolation for our seniors. The Civil Generation Office has proactively checked in on our seniors with weak family support and refer them to relevant support services, including befriending where necessary. I'm also happy to know that many of our seniors are staying in touch with their family members and friends through phone and video calls. Many have also taken to social media to stay in touch. Since 5th of May 2020, some 130 traditional Chinese medicine medical halls with registered TCM practitioners have been allowed to sell retail products on top of the consultation and herbal dispensary services which they were already allowed to provide. We have received feedback from some seniors that they purchase medicine also from TCM medical halls and find it inconvenient if they have to travel far to these halls. A Member of Parliament, Lee Bee-Hua, also raised this issue in Parliament this week, and I had promised her that I would take her feedback seriously. Indeed, I have asked the Ministry of Health to do a review and I'm happy to share that from 12th May, all TCM medical halls will be allowed to sell retail products. This will provide more convenience, especially to our seniors. However, the medical halls must put in place the necessary safe management measures before commencing operations, as they serve many seniors. Let us work together to keep our seniors safe. Let us keep up our good habits, such as safe distancing, personal hygiene, and wearing of masks. Avoid interacting with seniors if you are unwell. Together, we can protect them from the infection.